Hello, I'm in the car, so I don't have a camera on, but I am here. So,
Oh, okay, great. Welcome. And Joel, I see you're here. And Kathy, welcome. And John, Yeah, John's here. So I think, uh, and Tim. Good. I think we have everyone we're expecting, I believe. So, all right. So let's go ahead and get started. I want to, maybe just to start, allow Rachel to introduce themselves. Rachel is the new NEMT policy person with OHA. Just started, I think, Monday. Rachel, is that right? With OHA. So this is really exciting news to be back fully staffed or more fully staffed with some turnover and promotions and job shifts and those types of things at OHA. And Rachel has quite a nice background in transportation and AMT, so I think they're going to be a really added benefit to the program. So Rachel, do you want to go ahead and introduce yourself?
Thanks, David. Hi, Charles, and hi, Tim. This is Rachel Manley. Pronouns are they, them, theirs. I have been involved in NEMT.
Rachel!
Yeah, hi, friends. Long time no see. Um, yeah, so know a couple of folks as just shown from working at my days at Care Oregon. I was over there with the transportation team for about 5 years, kind of getting the ball started, and that team has grown significantly in the last several years and gone through some transitions, to say the least, with some certain brokerages. But I actually come from the world of scheduling for NEMT. That was my first kind of dip the toe in the pool, so to speak. So kind of been at all sorts of different levels and so excited to be here and continuing to help with this amazing benefit. So hi, everybody.
Great. Thanks so much, Rachel, and welcome. Carla, if you want to put our slides up, we'll do our introductory information, and then we'll jump into things. So today's meeting, March 20th, first day of spring. Go ahead and go to the next slide. So for today, we're really going to be focusing our discussions on language access and driver and member no-shows. And so we have had back in the past, we've had discussions, conversations pretty detailed even about both of these areas. I think it's time for us to revisit, sort of see where things have gone since we last talked about it, and then hopefully be able to put together some formal recommendations, requests, whatever that might look like from the TAC to OHA to look at improvements in these two areas. So we will first be talking, before we get into those conversations, we're going to close out our last TAC meeting conversation around the recommendations for grievances and appeals. So we were able to put together, I think, a really good set of recommendations for OHA. Those were sent out. Y'all had an opportunity to review those. And we have this sort of the final draft in front of us. We'll get into that in just a minute. Then we'll move to ensuring meaningful language access conversations, really looking at sort of current state and what the requirements are and what might be done to help with that improvement. We'll move then to monitoring and improving driver and member no-shows. And then finally, we'll do our next steps and wrap up as we look to the main meeting. Couple of reminders about sort of our session format and rules and those types of things. This is a virtual forum. It was created about a year and a half, 2 years ago, to generate recommendations and provide feedback to OHA on just improvements in general, broad and wide, to Oregon's NEMT system. And to make the most of these conversations and the work of the advisory committee here, TAC members will need to be flexible. The content really is guided by you all. and the OHA NEMT project team, and the discussions that we have at each of our sessions. So as we sort of have done our planning, there has been shifts and changes based on sort of what those conversations have looked like, where you all have wanted to go, what your priorities were. And I imagine that will continue to be the case. During our discussions, it's really important to be open, honest, and humble. There's a lot of different perspectives here. That's by design. People come from different places. They have different roles and responsibilities within the NEMT system, and we have an opportunity to learn from one another by really embracing the expertise that each of you bring. Those conversations are best when you all are engaged, actively participating during the sessions and between sessions, and that doing so gives us the best opportunity to contribute and make good recommendations for improvement. Next slide. We're on Microsoft Teams, which gives us some advantages and disadvantages. Advantage, it's really easy to bring a big group from across the state together like this without a whole bunch of logistical travel and accommodations and all of those things. So people are generally more able to come together in this way. But there's also some downsides too, or some things that we need to guard against. So a few things here. As we have our sessions today, TAC members, please use your webcam whenever you can. It's helpful to not just be able to hear folks, but to be able to see you all as well. When you aren't speaking, however, make sure that your microphone is muted so we don't get crosstalk. We have a large group of people here, so if you can use the raise hand function within Teams, that'll make sure that I see that you have something that you want to say or a question that you want to ask or whatever, and I'll get to you as soon as I'm able. You can also use the chat feature to add information, ask questions there. We try and monitor that to make sure that if you have those questions, we can answer those sort of in real time. If you're having technical issues, Carla's here helping us today, so you can send a message to Carla. And then just most importantly, really participate, collaborate, and engage. A reminder to members of the public who have joined us today, would ask that you stay in listen-only mode, and that really means to keep your cameras off and microphones off for the duration of the session, so that there isn't distraction, and the focus, especially with this large group, can be with the TAC members being able to interact with one another. There is a NEMT TAC webpage. The address is there. All of the meetings are recorded, and the recordings and transcripts are placed there, as well as meeting slides and any other materials that we go over in our meeting. All right, next slide. So we're gonna, as I mentioned, well, actually, before we get to this, I wanted to check in on our recommendations to OHA regarding the grievances and appeals process. I think that we're in a place based on the feedback that I received from all of you, or didn't receive in some cases, which is great. I took that to mean that you were good with the draft. I think we have a really good draft ready. So I just want to check in, make sure that everyone's fine with considering that final, and if so, then I'll get that sent over to OHA as a formal submission from the TAC. And if not, if there needs to be some conversation, then we can have that too. So is there anybody that is not okay with finalizing those recommendations and sending them to OHA? George, what you got?
Yes, on number 3, on the recommendations for improvements,
Okay.
on number 3, could you give me a little bit of an idea as to how the required CCOs are addressing the provider grievance in a timely manner and document their resolutions?
Okay, give me just 1 second to get that in front of me. So
David, that's the second bullet under.
Okay, I'm looking at this now. So George, you're asking, so what this document is saying is to make, under number 3, establish a formal complaint process for transportation providers. So it would be for the providers. And then if OHA followed the recommendation here from the TAC, OHA, would require that CCOs address the provider grievances in a timely manner and document those resolutions. So there would need to be a process in place for drivers to express concerns, and the CCO would need to have something in place to make sure that there was that place to complain or file a grievance, and that was tracked and followed and concluded.
So the CCOs have to report to OHA about this.
So they would, if this is if OHA adopted this recommendation. So I don't know that this is happening right now, especially with this focus on drivers. So there's lots of other things, and there's definitely the ability for like providers and OHP members to complain. I don't think there's anything that's as explicit as this about drivers. So it would go a step further in saying drivers need to also have this, and the CCO needs to do it, and then at least on request, report back to OHA.
Okay. With everything else that I will be okay with. I just had a question on that one on number 3.
Okay. Okay. All right. Great. And good question. Thank you. This is an area that's it's a little specific or a little different than maybe what the focus has been historically. All right. Anybody else? Otherwise, we'll go ahead and call this good. All right. Thank you. Really good work on this, everyone. I think this is a really good set of recommendations, and I think if these are adopted, that it'll go a long ways to improve the grievance and appeals processes. All right, now we're going to move into our next conversation about ensuring meaningful language access. And we've got a few folks from OHA here to talk to us about the current requirements, what this looks like in terms of processes and requirements for language access in NEMT specifically. And I think Michelle is going to start us off. And if folks can, everyone knows you, Michelle. I think so. Your introduction can probably be short, but if folks can just give a brief introduction as they start their portion of the presentation, that would be great for the TAC.
Yes, absolutely. Thank you so much. Glad to be with you all this afternoon. Michelle Mavison. I use she, her, they pronouns, and glad to just be with you once again today and to talk a bit about our current requirements for language and communication access related. And then we'll turn it over to some colleagues that we have joining us graciously to talk a bit about meaningful language access more broadly. So I'll turn it over to Monica and Christina after this, and then we'll hear from Joan as well with results back from our survey that we've had going on for language access. But first, just to pretty briefly run through the background or where our current requirements are for this. So we do have organ administrative rules that you see here on your screen, and these slides will be shared out afterwards, so you can access the slides and the links to these OARs if you'd like to have them. Also within coordinated care organizations for non-emergency medical transportation, we have some deliverable requirements related to this. And then we're also seeking some further CCO contract related changes. So first off, with what we have within OAR currently, our organ administrative rules, we had rulemaking that happened and that became effective January 1st, 2024. And within the scope of that rulemaking, really it was to bring it up to speed. The rules hadn't been touched since 2001. And so we had quite a bit of things to update. And we also were making changes to member reimbursements to change that methodology and increase the reimbursements to members for meals, miles, and lodging But as we went through that rulemaking process, we also saw that there was nothing mentioning culturally or linguistically appropriate or language access. None of those words came up if you searched the rules for NEMT with OHA. So that was, of course, very concerning. And so we made some initial efforts and worked with partners in Office of Equity and Inclusion and community program engagement partners to get some language into the rules, but we know that there's more needed. This was just kind of, to at least make that initial progress in getting better language into rules. So effective January 1st, directs that for responsibility for providing NEMT, and I won't read the whole thing here, but it includes access to culturally and linguistically appropriate tools, alternative formats or languages, and then as well as language access services. So there's that one, as well as within client rights and confidentiality. We added to that rule as well that brokerages must treat clients and require subcontractors and all drivers to treat clients in accordance with another OAR within Medicaid programs, including but not limited to having representatives that have communication and materials explained in their preferred spoken or sign language. So these are just some of the basics, like I said, that got put into rule as part of the responsibility for this NEMT benefit, but we would like to see what the TAC recommends and see how we can further expand on that. As we proceed with any further rulemaking, we would definitely want that to be a part of that scope. And then also currently on the CCO side of NEMT, within the deliverables that the CCOs are contracted to provide, we have the rider guide as part of those NEMT CCO deliverables, and within that criteria, starting for 2025, we were able to add some requirements in the evaluation. So this means it must be included in their rider guide, and we were able to expand the taglines for non-English languages. So this is just to highlight all the words in highlighted have gone into effect newly for 2025 for the rider guides to continue in that effort, like I said, where we want to make this more robust and ensure that we have the requirements there so folks can safely and effectively get their rides completed and be able to communicate, which is really very, very, very important. And where we've seen a lot of issues, frankly, within NEMT related to that. So it's been definitely a focus of OHA's and in partnership and collaboration with the TAC as well, from recommendations that you've had thus far, and definitely interested to see further recommendations on any of this as well. For now, we have the opportunity right now to propose CCO contract language changes for 2026. That'll end the 5-year period of the CCO contracts, and there will be a new 5-year period starting in 2027. So it's a bit difficult to get contract changes in the last of that 5-year range for 2026, but we're trying. And some of the proposed changes that we're seeking to make is to ensure that the rider guide is a standalone document. Right now, CCOs have the option within their contract to include it in their member handbook or as a standalone document. And we think that from what we've heard with member experiences and things, it sounds like it would be really helpful and more accessible to members to have it as a standalone document instead of embedded into a member handbook type of document. So we're seeking to have all CCOs treat this as a standalone document separate from their member handbook. Currently, only 2 CCOs embed their rider guide information within their member handbook. But again, we'd like to stop allowing that option just so we can ensure that the rider guide is accessible for members. And then we're also seeking, if we can, and this is taken out of recent CMS guidance, to have Contractors of the CCOs have communication devices available within NEMT services for subcontractors to allow drivers and members to communicate in the member's spoken or sign language. So that will be new if that gets put through, but all of this is not finalized. We're making those proposals, and we can definitely, keep the TAC informed on if we get that into the 2026 contracts or not. There's going to be some presentations coming up to the CCOs, and so that's to be determined if these go into effect or not. But overall, we really want to better understand what's happening currently, which will lead us to part of the next topic about survey results, and to have better monitoring to ensure even these basic requirements that I talked about on the previous slides that we have in effect since January of this year, but that we would like to have better monitoring than what's happening now. And seeking, like I said, to update OARs and things continually to have that, requirement be better met, or however we need to make it more robust, or, whatever really the TAC recommendations lead us to for better training, any of that. So we're looking at those partnerships and engagements and exploring open to solutions to create further improvements in this area as well. And with that, I'll turn it over to Monica and Christina if you'd like to. I think you have some experiences you could share with the group, and to talk a bit more broadly about meaningful language access.
Yes, thank you, Michelle. This is Monica. I'm from OHA, the Community Partner Outreach Program, and we serve a network of 300 plus organizations across the state. And with these organizations, they assist members, OHP members, enrolling into their OHP benefits, but also so that they understand their benefits. And so anyway, we have a website that we can share with you if you're more interested about what we do. But with that, we also receive a lot of examples and cases of language access. And this time we have some examples of the transportation and how some of the barriers. So I will share a few, and then also have my colleague Christina, who will also share some first. So let me just I need my notes so I can't read those. Okay. So the first one, this happened in Corvallis, and this is in June 2024. So a community partner scheduled a medical appointment for a mom speaker. So mom is a Mesoamerican language in the speaking Guatemala. And in this, the community partner was able to schedule a ride to be picked up to take them to their appointment, but they were dropped off, and then they were given instructions to call back when the appointment was done. And so because the driver only spoke English, basically the client didn't know how to call, or couldn't communicate, so he just walked back home. So that was one issue, again, because of the language barrier. The other one I have is this happened in November of 2024, and this is in Eastern Oregon. And the incident happened with transportation, and there's other issues, that it was not having a car seat for the little boy, and they figured that out. Community partner helped them with a car seat situation. But then on the day of the appointment, the driver showed up. It seemed like they got lost. They called the client. The client didn't understand. Finally, they were able to figure out where the location was, but the client felt uncomfortable getting into a car with somebody who didn't know how to communicate. And so they didn't go to the appointment. They missed the appointment. And this is an appointment that they've been waiting for months. And so, again, it's just an issue with the interpretation, not having bilingual drivers. And the other one I have, this happened in Monoma County. This is a older person who needed physical therapy, and they needed multiple appointments. And they were able to schedule transportation. However, same situation, driver didn't have a way to communicate in other languages. This one was also in Spanish, and the person just felt like, not communicating. It's not, yeah, it's just uncomfortable, didn't feel safe. So then daughter decided to actually hire a private driver, which is very expensive. But then the father was able to feel more comfortable because the daughter couldn't take them, a lot of, physical therapy takes a lot of appointments weekly sometimes. And so it was just easier for her to come up with money with their family members to like help support this transportation situation. So that's kind of some of the examples I have, but I will let my colleague Christina share her experience too. Thank you.
And thank you everyone for having us here today. So my name is Cristina Hernandez. I use she, her, ella pronouns, and I'm also with the Community Partner Outreach Program. So I did want to provide some additional feedback or like context about in our program, like we work with a lot of organizations that get grant funding from us, where part of their job is really to support people in navigating the healthcare system and using their benefits to the extent possible, right? And so many times our partners have, talked to us about, and this is things that happen literally within the last year, sometimes within the last couple of weeks, about challenges of like they've having been doing this work for long enough, sometimes they have to figure out like tips and tricks on how to best make sure like one partner who serves COFA community members, so people from the Republic of the Marshall Islands, the Republic of Palau, or the Federated States of Micronesia, she's had mentioned so many barriers in getting like if she scheduled a transportation appointment for somebody to be picked up and she wasn't there, many times they would get left behind. That there was no communication or poor communication in letting the person know, hey, we can't find you, or like we can't find the location where you are. So what this partner had to start doing was, she says, on the day of the appointments, I show up to the person's house and I wear the brightest color top so that the driver can't say like, I don't, I'm wearing a lime green top so that I'm waving at you. I'm standing on the corner of this street and this street. I'm doing this, and they're doing all of these things possible to try to make themselves as visible as possible to the drivers. And still a lot of times, she's the one having to call in, trying to figure out what's the location. And if she wasn't there to be able to support those families in like to interpret to do that, then a lot of times those families go without getting to their appointments. Many times she had mentioned that partners were or patients or members were getting dismissed from the providers' offices because they had had so many no-shows because of issues with NEMT. And this was stuff that had happened in the Marion County, Polk County area. And also similar to like a story that Monica shared about the person with the mom speaker that had to walk home. We've also heard stories here from, same people who don't speak English as a first language, who have to go to OHSU. So again, Salem, Independence, Monmouth area, who have to go to OHSU. Same thing, they get handed a card saying, call this number when you're done, but the person doesn't speak English. So even just knowing that they're supposed to call at the end is a miscommunication there. And so we've had stories of people who get stranded up in Portland or, hours away from their home. And then they have to call the partner to try to figure out, how do we get back to our home after this appointment. So the last story that I wanted to share is just kind of one of the other pieces of feedback that we had heard, and this was also kind of something affecting the Marion Polk County area, that a lot of times like Russian speakers, primarily Russian speakers, they had had so many issues with getting services, like linguistically appropriate services, as they were getting their non-emergency medical services, and running into so many issues that a lot of that community just said, you know what, we're actually just going to stop using NEMT, and we're trying to rely on volunteers from churches or from other options. And that's also, a gap in getting those individuals the care that they need, right? They're going without a service that OHP is paying for them to have. And so we just wanted to highlight some of these examples of the barriers that community members face. And I think especially going back to one of the stories that Monica shared about people who, like, if the driver shows up and they don't speak English and they're not able to say or the family doesn't speak English, and they're not able to communicate and let them know, like, hey, I am your driver, I'm here to take you to your appointment. Especially in this political climate, a lot of people who, regardless of what their immigration status is, sometimes they feel uncomfortable because they don't know, like, who is this person? Is this actually a driver, or is this potentially law enforcement agency coming to find me? And so just kind of highlighting the importance of how not having language access supports can really impact and affect somebody's ability to access the care services that they need. So I think that's, I don't know if Monica wanted to share anything else, but we just wanted to give you some of those examples of what we're hearing from community members from all across the state, in our day-to-day roles.
That's all we have. I don't know if there is any questions, comments, or Michelle, if there is anything else, but just wanted to share some examples. Thank you, Christine.
Great. Thank you, Michelle and Monica and Christina. Very interesting and helpful information. Sounds like there's definitely some work to do. Some good things have been put in place, but it sounds like some of those processes and actually making sure that that's happening on the ground still requires some work. So thank you very much. John, it looks like you have your hand up. Did you have a question or a comment?
Yes, I was hoping that, well, first of all, I want to applaud the work that you're doing. I think that's wonderful for us to see that you already are intentional about improving language access. So thank you for that. I found some of those slides from the first part of your presentation quite helpful, and I'm thinking that might help us inform our work as we move forward.
Thank you, John. George.
Yes. One question I wanted to ask is, with this process and being in the new contracts coming up, are the CCOs going to have what they call a deaf reader, where the people that are deaf that can read the information when they're in contact with the CCO customer service about grievance and stuff on the NEMT? And the second question is, will the drivers, the providers, how is that going to tie in of them understanding languages that they don't know about or be required to know the language when they pick up a client?
Yeah, thank you so much for that question. Oh, sorry. Okay. Yeah, this is Michelle. I was going to say, just thank you so much for those questions and comments. So yeah, for those questions regarding the piece regarding for members that are deaf, I'll have to go back and see if this would be inclusive of that. That is something definitely we've heard about is a need. I don't know if that will make it in, and even the proposed changes that we have right now, it might be very difficult to get it in for 2026. But while we have the opportunity currently, and I can follow up on updates on that and what the timeline looks like, so you all can be informed on if that gets put through or not, essentially. But within what we've proposed for now for 2026 contract would be devices, and that needs to probably be further defined, what kind of devices, making sure that it's devices that pick up accents and things like that. So I'll have to follow up on the piece for deaf members, what device might be part of that capability moving forward with CCOs, and then more broadly, like I said, I'll follow up in general if the proposed changes get through. So I'll follow up on both those pieces, but just again to reiterate that it is being proposed. We don't know if we'll get it through. A lot of things they're trying to, within CCO operations, they're trying to have a really, really difficult and high threshold, unfortunately, for getting it in for 2026. versus 2027, which does give us quite a bit of time to gather more recommendations and more details of what that should look like. And if it doesn't include, for deaf members right now, what that should look like. So we will definitely have time between now and when we need to pursue for 2027 CCO contracts. But I can definitely follow up with more detail and keep you informed as far as any changes to go into effect for 2026.
So what about the answer to the second question I asked? About the providers that's picking up clients. How are they going to learn the language besides English?
Right. So what the requirement would be, the proposed requirement, if it gets put through, would be a CCO requirement to work with their subcontractors and the drivers to supply them essentially to ensure that they have devices to use so that it can be translated essentially from, if it's an English speaking driver to translate into another language that's non-English. So that's how that would work, but it'd be a CCO responsibility to work with and provide that at the driver level. So, yeah.
Thank you, Michelle.
And Michelle, just one point of clarification. I wanted to make sure that I'm following this correctly. So right now, with the updated administrative rules that you shared that went into effect in 2024, transportation providers, CCOs, and others who are arranging for providing transportation are required now to accommodate people who don't communicate in English as a first language, right? Regardless of so that's an existing requirement that they have to do. And then this change that you're talking about is really like getting down to some specificity about how a transportation provider or a transportation company or a CCO would meet some of those requirements, right? Where like having equipment on board or those types of things. But so I guess in a nutshell, they have to do it right now. That's clear. It's not specified exactly how they do it. This would get into a little more specificity around that. Am I following all of that correctly?
That's exactly right. And as far as, rule versus contract, so our Oregon administrative rules supersede any contract language as well. So yes, everything you said is correct. And we already have those very, very basic requirements in rule. So those are enforceable. Those are requirements that exist since January 2024. But yes, this is to get more specific about certain devices and requirements for the CCOs because the language we have in rule is just really broad. I'm glad that it's there, but it's lacking, a bit more specificity that we could put in, and it's lacking monitoring, quite frankly, right now on OHA's end. So yeah, those are some of the improvements we want to make. And this would be one step in that direction with these devices to contractually require with CCOs.
Okay, great. Yeah, thank you very much. Joel, did you have a comment or question?
Yeah, a couple of thoughts. I'll try to keep it brief as best I can. I think, to kind of piggyback off the broad language that currently exists, I think that's where it kind of creates a challenge from a provider perspective, because obviously, we want to do our best to accommodate as many people as possible, no matter where they're coming from, where they live, what language they speak. Our goal is to serve people. So if that's the bottom line goal, I think the challenge, or maybe the gray area for us, becomes in actually providing our services or finding a way to accommodate and to provide our services. You can try every way to Sunday to pick somebody up or get a hold of them or communicate with somebody. You can call the brokerage to get a different phone number, or you can try to connect with a language access resource or an interpreter. And sometimes, because obviously we work with time primarily, that's where most of the barriers start to pop up for us, because it seems like, and this is again from more of a provider standpoint, that they're operationally at the input level when these rides are being created and people are setting these things up. We probably need to look at the process in which we're getting those rides out to providers and the amount of information required to actually then push those rides out to dispatch. Because I think oftentimes we have a pretty cookie cutter program in terms of like, yep, these are the fields that need to be filled out with information. Sometimes that information isn't there and everyone just kind of lifts their hands if you call on that information or the need for it, if it's not there. So I think maybe even being a little bit more heavy on the enforcement from the input side of things, meaning when these rides are getting built and created for these folks. So that way we at least have a fighting chance as a provider to get a hold of this person, show up and be able to provide the service that we're hoping to provide anyways. And this will naturally lead into our next conversation about no-shows too, because I think there's nothing more frustrating than a no-show where the member just wasn't able to get contacted or wasn't able to get in touch to know that the vehicle was there, and the driver the same thing, right? When both people are there, but they just can't find each other. Those are the most unfortunate circumstances. We want to try to avoid those as much as possible. So that's all I'll add to this.
Yeah, and I was just going to say, thank you so much, Joel, for those comments and feedback. I think it's really important, as we pursue better requirements, better things to ensure for the members, like those experiences we just heard about that we don't want to have happen, but also not making it cumbersome on the driver provider companies either. So right now, like that basic language and rule is a responsibility for NEMT services with brokerages and CCOs. And then this, requirement for having devices would be a CCO requirement. Because we know, for brokerages and especially driver companies, there's a really tight bottom line. We wouldn't want to put that, burden on that cost burden on the driver companies themselves, but we could, expand CCO global budgets and things where the CCO could have that type of funds to supply those devices. But we know there's a lot more needed and a lot of barriers, like you just alluded to work through, and other areas in the process of arranging a ride and getting a ride for folks, like, call center experience, and how to make that better for folks that are non-English speaking, and having maybe better training or, whatever might be recommended in those regards to get through some of those barriers. And like you said, give a fighting chance for drivers to make that connection successfully with the riders. So, thank you so much.
Yeah, definitely a lot of complexity there. I think we're just sort of scratching the surface. I think folks are, in the right place in terms of wanting to work on this, but it's challenging given the nature of sort of trips and time, like Joel was talking about. Needs to be quick for everyone for it all to work. I think this is probably a really good segue into our next conversation with Joan, in really looking at the survey that many of you provided some recommendations before it went out. And sort of ask what questions to ask and making adjustments and such. But looking at that survey to see what the current state of things is in terms of processes and understanding and monitoring and those types of things. So I think if we can go to Joan next to give us that, and then we can loop back around with some additional questions and comments, and then hopefully have some time to do a little bit of brainstorming about what's next in terms of recommendations, thinking from this group, from the TAC, in what folks should be working on, what OHA, the brokerages, others should be monitoring and reporting back on. So if that's okay, George, I see that you have your hand up. Is it okay if we move to the next presentation, and then you can be first up after that, or did you have something that you needed to share before?
We can proceed to the next, and then I'll ask my question afterward.
Okay, super. Thank you. So Joan, if you want to take us away.
Yes, hi, can everyone hear me okay?
Yes.
Okay, perfect.
Good
Thank
hear
you. I moved, so my equipment, I had to reset it all up, but I'm gonna go ahead and share my screen. And then just checking to see, can everyone see? It should be a slideshow with the title Non-Emergent Medical Transportation, Language and Communication Access. Okay, perfect. So hi everyone, my name is Joan. I use she, her pronouns. I am a policy analyst with the Medicaid transportation team here at OHA. I support Michelle and now Rachel on all things NEMT and GMT. So earlier this year, we had sent out a survey to fee-for-service brokerages and CCOs that provide non-emergent medical transportation. And this survey was to better understand their language and communication access services. There's quite a bit of information on these slides, so I may go through them a bit quickly. And I know we only have 15 minutes, but I want to let you all know that this information will be available to you to review after this meeting or to come back with any questions or feedback that you have about the results. Just a disclaimer, we sent the survey out to all fee-for-service brokerages and CCOs. We did not receive as many responses as we would have liked, but the responses that we did receive were quite robust. And so in the near future, we'd like to reach out to individual brokerages and CCOs just to get a good picture, again, of what is our current state of language access and how we can move towards a future state. So let's see here. I want to make sure that you are all aware that we do use some acronyms here at Oregon Health Authority, so you'll see a couple of them here in these slides. So if you do decide to review these slides afterward, I just wanted to make sure that this resource was available to you all. So just a quick overview of why we sent out this survey here. With the Medicaid transportation team, we really wanted to learn from our brokerages delivering NEMT services to OHP members what current processes, software, technology, and systems facilitate language and communication access for those served by both CCOs and fee-for-service. And for the much larger, bigger picture of this survey is to eventually reach out to individual brokerages that did not respond. But overall, the goal is to help inform potential updates to state policies and Oregon administrative rules to better understand what is working well and where we can make improvements for those who are being served through non-emergent medical transportation. We contacted all fee-for-service and CCOs delivering this service via email to fill out the survey. The survey was conducted through Microsoft Forms, both in multiple choice and fillable form. So the fillable form is where they can type in their answers. We received 7 responses. There were 22 questions total, 17 of which were specific to language access and communication, and the others were more to get information about the respondent themselves, like who they are, which organization they are, and just a way to have a line of communication with them. In the next couple of slides, it's just our primary findings that were summed up based on the 22 questions that we received. Again, it's a lot of questions, so I tried to sum up the more important findings that we received. So I'll just go through them kind of quickly. Again, I know we only have 15 minutes, so if you do have questions, feel free to type them in the chat, and I'm hoping we can get to those, if not today, maybe another time. So most respondents do utilize a variation of language and communication access services and platforms. We also noted that cultural competency trainings do vary across respondents. However, we found that they're not very consistent or are very limited across the 7 brokerages that did respond to this survey. We also learned that language access trainings also vary across the respondents. They were either not required or they weren't very consistent, or if they do provide them, they were very limited trainings. Drivers are aware of language access trainings or where to go when needing language access support. However, only 1 respondent did note that they do require interpretation service trainings for their drivers. To continue on some of our primary findings, so about half of the respondents, about 3 or 4 of them who responded out of the 7, do offer some sort of cultural competency training to call center staff. However, it is important to note that some of these brokerages do delineate that responsibility of providing trainings to the providers or the driver companies themselves as a responsibility. And again, this varies from each brokerages. In terms of cost and availability of interpreters, varied formats, cultural competency and responsiveness trainings, translation services, these were the main barriers that each of these respondents provided as main barriers to providing language and communication access and services. So only about 2 respondents selected limited access to software as a barrier to providing language access and communication access services. And we'll go into detail in this in the next couple of slides. So this question was a fillable form where we asked respondents if they would like to type in their answers and provide some feedback or some suggestions. So we wanted to know what common language and communication access barriers the organization hears from OHP members, communities, call center staff, drivers, or beyond. So 2 respondents came to us with the following. So the first answer that we received was that the most common issue they've been told about is when drivers and members cannot communicate easily. So typically when this is brought to the organization's attention, they will try to patch an interpreter over the phone to assist with the communication gap. Another brokerage responded that the NEMT brokerage partners typically report that they receive little feedback or insight on barriers, concerns, or requests from partners other than members. And transportation providers sometimes involve others in meetings to discuss these barriers, but they don't always cite language barriers as the reason for members. Common language access barriers that they have noted from members include navigating automated phone systems, usage of interpreter service, and communicating with the driver and the vehicle. We also asked our respondents what kind of software technology or services that they currently used. So they provided us with a list that they use with their members or their drivers. The most popular one is Linguava, followed by Language Link, Language Service Associates, Natural Reader. And there was an option to select other and complete a fillable form, so type in their answer. So a couple of respondents did note that they use AI interpreter-based services or telephone interpreters to provide language or communication access for their members. So the general feedback that we received that ties into the software that is used, we wanted to understand kind of the pros and cons of the software that is currently in use or that the organizations do use. So the pros, the top 3 choices that we received were that using software is actually pretty simple. It's on demand, so it's something that they can pull up pretty quickly and use on the go or use when it is needed, and that billing is quite easy. There are some cons of current language and communication access software that they noted, which include limited circumstances where languages of lesser diffusion. So with this term, it means that languages that are spoken by a small number of people compared to the widely spoken or taught languages within a population are sometimes not available. So there's also no way to proactively know members' language needs. And then some software is not certified in Oregon. With this particular point, we brought it up, Michelle, Maria Gonzalez-Kress and I were talking about this specific point about software being certified in Oregon, that this is definitely something of interest to look into. The respondents didn't really give much detail. The one that gave us this answer, other than the software not being certified in Oregon. So we're not exactly sure what that means, or if it's simply just software like a translation service or a translation website that is pulled up in the moment of need. So this is definitely something of interest to us when it comes to what softwares are certified in Oregon and what is not. And then another con of these softwares that are in use are unreliable connection and network. So at times when a driver or interpreter needs to use the software, is their connectivity. And sometimes a con of that is that there is not often that ability to connect or use Wi-Fi or internet or the network that is needed for the software. Because the survey is to help us understand what current language access services there are, we wanted to know what kind of Oregon administrative rules create or cause these barriers to ensuring language and communication access services. So we received the following responses. The first being that one brokerage noted that member-facing materials need to be approved by OHA. This one is pretty broad, and it does touch on, other program areas and, NEMT being one of them, since there are quite a bit of, member-facing deliverables, member-facing materials. Again, they don't list the specific OAR, but we understand that some deliverables that providers, CCOs, or brokerages provide, there are a list of requirements in order to meet the criteria to be member-facing, especially when it comes to communication materials. In my personal background as a previous background as a public affairs specialist with OHA, I can understand that this is, definitely a barrier when it comes to language and communication access and services. When there are requirements for, member-facing materials and how to ensure that we're meeting those requirements while also being accessible and equitable for those that require those resources. Another requirement or OAR that they noted was the broad community knowledge and guidelines that are difficult to become an OHA certified interpreter. So sometimes this could deter local language speakers to apply, and thus creating less local qualified interpreters. And while they didn't list the OAR with that first specific point, it actually does touch on the OARs that were provided by other respondents. And so we can understand that, in order to be a certified interpreter, there are quite a bit of qualifications that need to be met. And those qualifications can sometimes create barriers in order to be certified and, support your the NEMT program. We did receive feedback that there are some Oregon administrative rules that actually do support organizations' knowledge or obligation to provide language and communication access services. We understand that this topic of language access is pretty broad in general when it comes to OARs in the NEMT side of things, but they did note one in particular, the first one being that there is an Oregon administrative rule that lays out record-keeping requirements for healthcare providers and healthcare interpreters. And then that is part of a requirement for Oregon Medical Board licenses. Another respondent did note that there is an Oregon administrative rule that outlines the CCOs and by extension, the subcontractors or driver companies requirements for member education and information, including member materials and access to interpreter services. I know we're coming up at time, so this is my last slide, but I wanted to make sure that we provide as much information that we did receive from our brokerages and the organizations that did participate. Some general comments and suggestions that they left us were the following. The first was, that they suggested we provide a proactive, balanced, and strategic approach to meet the needs of NEMT clients needing language and communication access. And this is what we hope this survey, just knowing what current state is, even just amongst the few that did respond, will be very helpful for us moving forward in reaching out to individual brokerages and CCOs and to help inform future state when it comes to updating policy and Oregon administrative rules. Another suggestion was to provide more support to language and communication access for languages beyond the top language use in the state. As we saw, one of the problems with using software is that it's not always available in languages of lesser diffusion. And that could also be said the same for member-facing materials. Member-facing materials often need to be requested in languages that are not in the top language use of the state. Another suggestion was to ensure language and communication access and support in partnerships between the state, CCOs, brokerages, and private partners. One organization wanted to enhance training programs for interpretation and language translation services, and I think this is such a huge priority, just already seeing from the respondents that did come to us with this survey that, it's not very consistent across those that did provide answers when it comes to training programs, or it's not required. And then we also want to leverage technology to provide real-time translation services and virtual interpreter support. I think this is one of the pros of having software, is being able to leverage technology, especially in rural or underserved areas. And then the last one is to establish robust feedback mechanisms to regularly assess the effectiveness of language and communication services, and hopefully make necessary adjustments based on patient and provider input. And I apologize, I know we're coming up on time, and I'm not sure if there's going to be time for questions, but if there's any in the chat, I can't see it right now. I'll make sure to note those. But this presentation will be sent out to you all, and you can contact me at this email right over here for any questions or feedback with this survey.
Great. Thank you so much, Joan. A lot of really good information there for sure. Let's take just a couple of minutes here to see what questions folks have, and then we'll move in briefly to sort of starting the conversation about recommendations on how to improve the system. So, George, why don't you go ahead?
Okay. One recommendation I would like to bring forward, if OHA would bring it with the CCO contracts and providers, would be that when brokerages are sending information to providers to be picking up consumers, I'm wondering if it violates the ADA Act if the brokerages would send out, along with the information to the providers, that the person that's disabled, whether they have a hearing impaired or blind or being a physical. So then when the provider goes to pick up the consumer, they will automatically be a lot quicker for them to know what the consumer is about. Where they have, or what type of language that they're, maybe help the provider, what type of language barrier there is. To kind of help them out. Would that be an ADA concern if that was to happen?
So let me, I think this seems similar to me and what Joel was talking about in terms of the information that gets transmitted or not to the transportation company about sort of one of those fields, it sounds like, is sort of language support needs. Sometimes it sounds like that is complete and sometimes it's blank, even though, and it sounds like sometimes it's blank even though the person needs some language support. So I take from that it's probably not a violation, but I don't know, does anyone know or have any comments on that? So George, let's I'll work with OHA folks offline to get an answer on that. But I've captured this as a potential recommendation for the TAC to put together to make to OHA to make sure that gets transmitted, and any information really that could be helpful that wouldn't be a violation of HIPAA or ADA or other federal requirements.
I just
Joel? Oh yeah, go ahead. Sorry, George.
I just feel that with this in the process would help providers having no conflict with consumers.
Yeah, no, that makes a ton of sense. Joel?
And
Go for it, Michelle.
I was just going to say very briefly, any recommendations we do get, we'll make sure to cross-reference with, any HIPAA or ADA or all other compliance aspects as well.
Go ahead,
Should
Joel.
I go? Okay.
Yeah, please.
I was just gonna add I need to give flowers to Charles and the dispatch team at Ride to Care. They do a phenomenal job getting that sort of information to answer your question, George, getting that sort of information in trip notes for as many members of that program that they know about or understand the different level of service that they might need from providers. So having that information available to you in trip notes is really helpful as a provider. I would add that it's not necessarily a field that is gathered in most NEMT softwares. I would argue strongly for that level of assistance need being an actual field in these softwares, because it does provide a much smoother experience for not only the person receiving the services, but the provider who is providing the service. So just wanted to add that.
Okay, great. So I had a clarification or a question for maybe Joan or Michelle. So it sounds like a lot of the responses that you received talked about the state requirements that they work with qualified or certified healthcare interpreters. And I just wondered if OHA, if that is accurate, that qualified or certified healthcare interpreters are required for NEMT. I don't know if you know that, or if that's something we can look at in more detail offline.
Yeah, no, thank you so much for bringing that up, because I did want to just clarify that, that was part of feedback we had received from respondents on the survey. But no, for NEMT, we do require, we have, in rule to require interpreter services, but it is not required that they be certified healthcare interpreters. So yeah, that's a great clarification to make sure everyone understands.
Okay. And I'm capturing that because it sounds like there's some education that's needed out there as well. So I'm adding that to sort of the potential recommendations that the TAC might make. Great. All right. So we're a little bit over time, but I want to just take a couple of minutes here. I've been taking notes as we have been hearing presentations, as y'all have been asking questions and making recommendations. But I want to see sort of where you're at in terms of other recommendations that you would like to see in a document that the TAC can put together and formally submit to OHA regarding language access. Sort of where are you seeing the opportunities to make improvements in language access in the NEMT program? All right. Yeah, George.
While we're on the subject, will be or has the new rule of CMS 90-day rules from January 1st being enacted on the EMT for grievance process?
Michelle, do you know this?
Yeah, I'm not sure, and I don't think we have Andrea with us. They're more familiar. We have other staff that's more familiar with grievance and appeals related, so I'd have to take it back internally and get that response back with you.
Seems like a reasonable bet that anything that wasn't already enacted probably hasn't recently been enacted in terms of changes like that, but some additional clarification would be great.
Yeah.
I would like to see it in the consumer books, in the NEMT books, where it specifies the consumer has 90 days. The consumer itself needs to know how long that they need to get the grievance in.
All right. So we'll get back on that one, George. Thank you. So I also sort of on the opposite side of like recommendations, so I didn't hear, we have a couple for sure, but I didn't hear a lot. And so I'm wondering, given sort of what we heard, what OHA has put in place, the things that they're already working on in terms of improving language access, are you all seeing a need for the TAC to weigh in on this at this time? Or do you feel like it's, sort of in a good enough place and progress is being made that the TAC doesn't need to do anything specific here? John, did you have something?
Yes, I kind of agree with your statement before. I'm very pleased to see the degree of intentional work that's being done right now. I think if we're going to do anything at all that could inform their work, it might be just to examine more closely the wonderful materials that they presented today and see if we can come up with anything by way of suggestion. But I'm quite satisfied stepping back a little bit and seeing how they implement their administrative rule.
Okay, great. Thank you, John. Kathy?
Yeah, I'm really happy with the intent, but what I'm not seeing is like the practical logistics, like how is this going to happen? And I think Joel was talking to that. Like there's got to be nothing more frustrating than sending a driver out who's not able to communicate with the rider, and then that rider is that ride is a non-ride, but now you've invested into sending a driver out for a couple hours and it didn't result in anything. And so I just feel like those practical elements, like how, yes, we want to communicate, but the how, I think, is the most important thing, because what we've heard is that this is already the law. So perhaps it's not happening because the tools aren't really widely available, or people don't know about them, or that sort of thing. And that would be for the transportation providers, tools, suggested tools for them to use, as well as the clients.
So that makes sense, Kathy. Do you think that this group is in a place to sort of make those specific recommendations about those tools, or what those processes should be, those types of things, or just provide sort of that guidance and admonishment, I guess, in that, the TAC feels that this work is great that's underway. Seems like it's on a decent path, but there needs to be, specifics developed. There needs to be specific monitoring put in place. And maybe we leave it at that. What do you think about that? I mean, if you have,
Yeah.
I'm sure they would love to hear, like, if you have detailed process ideas, or other folks on the TAC have that, that could be very helpful. But I'm just not sure that the TAC broadly has those better than, sort of the folks who are working on this already. I think some of our specific members might, but they're going to be like Joel and Charles and Tim,
Yeah.
who are sort of, working in this every day. But they're going to be involved in those types of things anyway. So I'm open to either way. I want to do sort of what the TAC wants to do here, but it's seeming like, there may not be like real specific things that the TAC can recommend.
No, what I'm saying is that I think it's more than just, sticking more detailed rules into law. I think there's, as Joel pointed out, the brokerages and the transportation providers are just as motivated to solve this problem as anybody else is. So yet it seems like there's a lot that needs to be done. So I would make a recommendation to OHA. Hey, reach out to, I don't know, RLS and Associates. Reach out to people who work within the NEMT system, who work nationwide, who have seen it all. They're the ones, along with Texas A&M, who pulled together all of these studies and all of these all of the models and tools that are being implemented and tried in a lot of different states. And I'm not sure, I don't know if it's OHA that we make that recommendation to. I mean, there's no one else we're making recommendations to,
Right.
but I feel like that information is out there. And I don't think it would be that hard to get and put together, but just making more detailed rules is not exactly, I think, what is needed here, because everybody on all sides of this is pretty motivated to solve it, but it hasn't happened yet.
Okay. Okay. All right. Well, let me do a little bit of work on this. I would invite all the rest of the TAC members to sort of think on this. It seems like our recommendations aren't going to be to the level of detail that some of our other recommendations have been. So it may be just sort of high level, like we've been discussing here. But see how that sits with you as you think about it more after the meeting and stuff, and then we can come back to that if we need to. So all right. So we're going to really great discussion and lots of opportunities to make improvements, I think, and lots of really great work going on as well. So we're going to shift gears now and start to talk about member and driver no-shows and opportunities to make improvements in that system. We've had this conversation, similar conversations across a number of meetings. As I mentioned at the start, I'm hoping that we can kind of culminate now in sort of getting to being able to make some specific recommendations on how this should operate. So I thought that what might be helpful, and Carla, if you want to pull up the slides. Yeah. So I thought it might be helpful, just a very high level sort of leveling for all of us. We have a number of TAC members who have been with the TAC since the get-go, been part of these conversations. We have a few additions who haven't necessarily been included in some of those earlier conversations. So I just wanted to do a little bit of level setting here on sort of what's required and where there may be some sort of flexibility or some room to work on sort of managing member and driver no-shows. And then we'll get into, from there, we'll get into sort of what's the current environment look like, and then we'll do some brainstorming at the end of our conversation here on, what might we be able to do here. So I think this first bullet here, I think everyone knows this, but I have it here to sort of put this is the federal requirement that states assure that Medicaid members have access to necessary transportation to get to their covered Medicaid services, their medical services. And there are some sort of limitations or restrictions that the federal Medicaid places on those. And those are that, it's only provided when it's necessary, lots of mechanisms and requirements to demonstrate that it's the least costly and most appropriate ride, and that it's to the nearest qualified provider. Obviously, this gets really complex sort of at the individual level, but sort of the overriding requirement is those bullets that I just went over. What that means is that there isn't a capacity, because states have to assure that all Medicaid members can access those necessary transportation services. There isn't a mechanism to say, well, there's a particular member who has been like sort of misusing or abusing this service, and so they specifically don't no longer have access to it, to transportation. So states aren't allowed to go that far in terms of sort of managing a member who is, has chronic no-shows, for example. In addition, the state and transportation partners really need to assure that driver no-shows and late cancellations are appropriately monitored, addressed, and corrected, so that if those things are happening, that has really significant impacts on members, and they need to have capacity and ability to be able to make sure that that's not happening and that they're working on improvements. And then the second piece here is that members are not denied transportation due to member no-shows or lateness, even if it occurs frequently. So with that, what do we have the capacity to take a look at? So Carla, if you want to go to the next slide. So for driver no-shows, and this is the conversation that I want to get us into here in just a little bit. But so be thinking about this. For driver no-shows and late cancellations, the state and its transportation partners, providers, et cetera, have to have adequate oversight and processes in place to ensure that scheduled transportation is furnished as arranged. That means that they have to monitor no-shows and late cancellation rates, and then be working to reduce those rates, to make sure that that's not happening, and when it is that they're working on improvements. They also have to have mechanisms in place to allow for replacement transportation providers with short notice. So if a particular transportation provider doesn't show up, or there's a late cancellation, the brokerage, the transportation provider needs to have the ability to send someone else, so that the Medicaid member, the OHP member, doesn't miss their appointment. And then they also have to inform members on how they can report no-shows, and that they can arrange for a replacement ride. So members are informed, and they can help sort of provide information back into that feedback loop for the state and for the transportation partners. Okay, next slide. For member no-shows, as I mentioned, federal Medicaid doesn't allow you to just put an ultimate restriction on someone, even a time-limited restriction that they can't participate in the program. But there are things that the state or the transportation companies can do, and this is sort of like getting fashion. They can work on counseling with the member. So Carla, there we go. They can require that members confirm the ride the morning of or the night before, or the ride won't be provided. They can require the member to use a single provider, and confirm with that provider shortly before the ride's to be provided. Or if they don't do that, then the ride won't be provided. So there are some abilities to sort of manage, counsel and correct and manage OHP members in this way. And this is where I want to spend some time talking today about, what might that look like, so that we're maybe sort of getting close to the ultimate restriction of you can't exclude somebody from the transportation program, but you have enough tools in the toolbox to hopefully to sort of adjust that behavior, or whatever might be going on. And then the final area is really around limited payments to transportation providers when there are member no-shows. And I want to talk about, what does that look like? When is that appropriate? When is that not appropriate? Historically, this hasn't been allowed by CMS at all. It's like if you don't complete a ride with an eligible OHP member, then no ride was provided and therefore no payment. They've opened this up a little bit so that under these limited circumstances that the state would have to define and get approved by federal Medicaid, by CMS, there can be some payments made for those no load or no show rides. So that's the sort of the final area that I want to talk about. So be thinking about those areas as you listen to sort of what's happening right now and the experiences of folks. So next, if you want to go to the next slide, Carla, we're going to hear from Steve Ailman, transportation provider, transportation driver on sort of his experiences with no-shows and late-minute cancellations. And then I want to go to all of you to sort of talk about what your experiences are, and just to make sure that we have some good understanding of what's happening out there right now. So, Carla, I think you can take that the slideshow down now. And Steve, I think I saw you here. So welcome. Really appreciate you being here. And if you want to give just a brief introduction of yourself, and then go ahead and share with us your experience in these areas.
He's muted. There we go. Let's try that.
There we go.
Happy to be here, everybody. And it sounds like you guys are deep in the thick of something that's really, really important. My views today are from a driver point of view, so they're pretty narrow and very focused on what the no-show experience is like. And I have some general comments that I want to make. If there's specific questions at the end, I'd be happy to address those as well. Several of you have touched all around the subject that I think is probably one of the key things that could be done to minimize no-shows is better information in what we know as the ride notes. And the ride notes are kind of where everything happens for us, because the driver lots of times will not know the individual or member. And so what's in the ride notes is what we get. If it's not in there, then we don't have that. And one of the things that is probably the biggest crux of not having a good connection with the rider is inaccurate data in terms of phone numbers and addresses. And it seems like that would be pretty basic to what would be needed, but many times the ride notes are not kept up to date. So, for instance, the person may have been transferred out of a care facility and into a home, a care home, not necessarily a professional facility, and the old number is still there. And so you end up calling to confirm the ride and say, I'm going to be on my way. I should be there in about 25 minutes. And they get upset with you because the person hasn't been there for 3 months and wonder why you're calling at 4 o'clock in the morning to let them know you're on your way. And it's a very unprofessional experience for the people receiving the call and for the driver. So number one is the accuracy of the notes. Number two, there's many, many no-shows because the driver or somebody has set up a ride for them, and there's a window involved that you can be there at X amount of time, let's say 6 o'clock in the morning, from anywhere from 6 in the morning, maybe to 6:30 in the morning or something like that. But there's an approved window. And if you arrive at the early end of the window, say 6 in the morning, the driver or the driver is there, they've made the connection, but the rider does not want to go for 15, 20, 30 minutes because the ride is only 10 minutes, let's say, from where they want to go. And as was noted earlier by one of you folks, there's lots of time schedules, lots of time impacts, and you're basically not able to wait for half an hour for them to come out of their house. You need to get the person, you need to transport them to their location, and then you need to be on to the next ride. It's all part of running an efficient business. So in summary, that is the driver or the rider not ready to go. And many times you're able to call ahead and let them know you're on their way, and they'll get ready if they're not ready, but sometimes that doesn't happen. And many times, even if you do call ahead, they still aren't ready to go when you get there, which is really frustrating from a driver point of view because you just fall farther behind in your schedule. Another thing I would mention is when there's a bad phone number, so I'm back to the data piece in the ride notes. When there's a bad phone number, as a driver, you can't even call ahead and say you're on your way. You just have to, by faith, go and say, well, they're going to be ready, and you just hope that they're ready. And if they're not, you've wasted resources driving out there. And it's not just the frustration. So the soft costs of frustration would be the hard costs, the monetary costs, the wear and tear on vehicles, the cost of lost opportunity or cost of nonconformance from a quality perspective. when you are busy driving out to pick somebody up that's going to no-show on you, you could have been driving to a paying ride and then advance the profitability of your company. And so that's a direct impact on the company as well. Another thing I would mention is many times the riders do not call into the not just the provider companies, but the actual people that set up the rides that we as a driver company get the rides from. So you drive out there and they said, oh, I canceled that, 3 days ago. Oh, I forgot to cancel. There would be responses like that. And so while it's not technically, I suppose, a no-show if they cancel, it's still something that needs to be done in enough time that it stops the driver from going out to pick up the rider and not make that, again, those hard costs and investment of fuel, wear and tear on the vehicle, and lost time to go out there. The main impacts with many, many no-shows. And I guess I would also add, per your last point, David, that apparently you can't exclude riders if they have a repetitive pattern of no-showing. But it's a psychological wear to know that you've gone to pick up this rider multiple times before, and a third of the time it's a no-show. 2/3 of the time it is a ride, but a third of the time it's a no-show, and you're just crossing your fingers when you drive out there. So there's a frustration factor on the part of the driver who wants to do a nice job picking people up. And many of the companies I know hire really caring drivers. But it tears apart that care from a frustration point of view when you are knowing you're going to pick up or you're going to drive to a rider that has historically had a high percentage of cancels or no-shows when you get there. One of the other things that comes into play in terms of a driver having lots of no-shows is and I don't know how else to put it, but I guess a lack of common courtesy. If you know you're not going to go on a ride, to pick up the phone and just call the person you set, or call the company you set the ride up with, and just ask them to be canceled out this time, but they want to go on their next appointment or whatever it is. So the common courtesy aspect is really a big frustration for all the caring drivers that are out there. So those are general comments that I would have on no-shows. Are there questions or specifics that anybody would like to raise?
Maybe while folks are thinking, Steve, just one point of clarification for you on the piece where you are showing up at a member's house and they're indicating that they canceled, but that wasn't communicated at some point. Do you know how, if that is happening, like in some cases at the brokerage level, like the brokerage, the people who arrange the transportation isn't communicating that to the transportation company, or do you have any sense of that?
I think it's a two-pronged approach, David. You have probably people that are communicating with the brokerage, but there's a time element involved when the brokerage is really busy in their peak time, early in the morning or whatnot, and getting that communicated back out to the driver provider companies. And then the driver provider company, their dispatch has to take and make that call directly out to the driver then and stop them. So there's the aspect of the relay chain going from the person who's making the cancel call all the way through. And it's not a quick thing sometimes. There's stuff, life happens on the dispatch front, and it didn't mean to get pushed off, but it did because there's another fire drill going on. And then from another point of view, the whole canceling piece is questionable sometime. I'll let it go at that.
Yeah. Okay. All right. Joel, do you have a question or comment?
Yeah, I was just going to kind of speak to your question, David. I would say there is kind of that, I think the question mark, I mean, Steve put it kindly. Oftentimes you show up to, your driver shows up to a ride and it's like, they said, they just told me that this ride was canceled. Yeah. And I think maybe sometimes the misinterpretation there is that their appointment was canceled. And so maybe there's a need for socialization to the process of, hey, your appointment is not connected to your ride. Or maybe there needs to become a trigger, and technology systems need to start communicating better between themselves from the healthcare provider standpoint to the members' transportation software. That seems like a really easy fix if healthcare providers' systems could communicate with the brokerage for this particular person. Technology seems like it could be utilized a lot in these sorts of scenarios to just kind of streamline these processes and take out some of the human error that naturally occurs. But that doesn't exist. And so I think the hard part is like, getting back to our language access conversation. What if the person, first of all, doesn't have the means to communicate that their ride was canceled? What if a third party canceled it or set up the ride and they didn't even know about it? Which oftentimes can be the case as well. Or, somebody's surprised that they're supposed to be going somewhere that day and refuse to go because they don't want to, and we're not, mentally prepared to leave that day. I mean, there's so many circumstances that you could bring up. It's so complex that there's not like a one size fits all, but how can we mitigate it? And I think that there are some reasonable solutions for that. Anyways, I got a lot more thoughts. I'll pause for now.
All right. Yeah, no, I appreciate that. And I think that point about, it may be confusing for some, like a member who isn't sort of, living in the system to understand that, calling and canceling a healthcare appointment doesn't also cancel the trip to that appointment. I think it could be pretty reasonable that they would think it would, just because, that's complex. So that's helpful. George, do you have a question or comment?
Steve, what do you normally do when there's a disabled person in a wheelchair and you show up for a ride and all of a sudden disabled person, something happened to him or her that is unbelievable, that they're embarrassed about? What steps do you normally take when that happens and they can't get into your ride?
That's a good question. It does happen. I wouldn't say it happens frequently, but it does happen. So you just work with them as best as you can. You explore all your alternatives to try to make that ride happen for them, including calling into dispatch and seeing if they have any other ideas. And then sometimes if it's a real live health situation, then you do have to call emergency services.
Okay. All right. Thank you, Steve. Thank you, George. Any other questions for Steve? All right, great. Thank you so much, Steve. Really appreciate you joining us today, and appreciate the work that you're doing out there and transporting the members.
Very good. Thank you. It's all nice meeting you. Good luck on your project.
Thanks a lot.
Bye-bye.
All right. So we've got about 20 minutes left total. And I want to do a little bit of brainstorming here, so then that we are in a good place to sort of do some work offline in like we did with the complaints or the grievances and appeals process, do some work offline and putting together our recommendations from the TAC. So as you think about each of these areas, so really like what sort of monitoring or processes should be in place to manage driver no-shows? What sorts of things should be in place to manage member no-shows? And then what parameters should be built around this idea of being able to, in these limited circumstances, pay for these no-show member rides. So what I think might be most efficient is if we take like 3 minutes, folks sort of think on these on their own, write some stuff down as far as recommendations, and then we can come and hit those. And if you feel comfortable and you're able to do that, you could put those in chat, then we'll have them, and we can talk about as many of those as we're able. So let's take the 3 minutes. It'll put us at about 4:15, say, and then we'll come back together to go over those. So is that clear to everyone? Sort of what we're doing here.
Will you clarify again?
Yeah, so it's really looking at these three areas. So you can, to the extent that you can sort of jot down recommendations for each of them, that's great. If you want to focus on one, that's also fine. But we're looking at managing driver no-shows and monitoring that, looking at managing and monitoring member no-shows, and parameters that should be in place for payments for no-show rides. And I think what you want to think about is sort of at the extremes. I mean, I think there's some good. So, for instance, with member no-shows, right? We talked a little bit about things that are not allowable and things that are. And so, as you think about sort of escalation in trying to correct and get a person to cancel, to not schedule rides that they're not going to show up for, those types of things. What sorts of things might be helpful in doing that? So we talked about sort of last minute calls, right before maybe the driver's heading out, or the driver doesn't actually head out. I think in the planning group, one of the folks had brought up the idea about requiring some sort of education. So, a little course or, just a reminder in a sort of a formal way that the member would need to complete prior to scheduling their next ride. So they'd have to go through, a little course, for example. So things like that in terms of how do we get ourselves to a place where we're seeing fewer member driver no-shows. So Joel, did you have comment or question about that?
Yeah, I mean, I've already kind of prepared my thoughts. I'm happy to jump in for the sake of time to get us rolling if you'd like, or I can give time for the group to.
Yeah, let's give a couple of minutes just so people have some quiet time to sort of think about it, and then we'll start with you. Okay. And if you want to, I don't know if you have them written down. If you wanted to put those in the chat, then we'll make sure that we get them all, and then you can give us some, and you can do that right now. Folks can add these to the chat as we're going through this sort of thinking time. All right, cool. All right. Let's go ahead and hit on as many of these as we can in the time that we have left. So Joel, do you want to kick us off?
Yeah, happy to. I'll just kind of fire off my bullet points and then I can put them in the chat after that. I was kind of typing some things out. So for driver no-shows specifically, I mean, they're just ultimately there needs to be a strong proactive dispatching process, whether that's on the end of if their brokerage dispatch is managing vehicles, or an NEMT provider themselves has a dispatch team. We work hard to run a proactive dispatch, which means if somebody's going to be late or outside of a pickup window, we are working actively always to ensure an on-time performance to at all costs avoid a provider no-show. It's very rare for us to ever no-show a ride as the provider, because they're called provider no-shows in our network. Very rare for it to happen. It's happened. I'm sure it'll happen again. But I mean, that's just kind of as a provider, that's kind of an unacceptable thing to have happen. If you aren't showing up to provide services for a trip that you are agreeing to, there's a big problem with that, and that needs to be strictly and strongly enforced. There's an idea of like maybe a 3-strike system, or immediate corrective action that needs to happen to prevent those continued reliability issues within a provider. Just having on-call vehicles. I know that the Ride Care program has what they call hourly vehicles that are just kind of floating around the city and get rides added to them as needed. And that's been a big help, I think, with kind of on-demand trips or things that are happening in real time when a provider can't make a trip or a vehicle goes down or things like that happen. That would be kind of just some ideas around things we can do to avoid driver no-shows.
Joel, can I ask one point of clarification on the no-show driver piece? That makes sense. That's pretty rare, and that's good. What about sort of last-minute cancellations? What does that look like on the driver side?
What do you mean? I guess
so where I guess like at the last minute, late, so a ride scheduled, but for whatever reason, the driver isn't going to be able to make it. So they don't just, no show, but they do cancel. And then either someone else needs to be scheduled to go out, or if that's not possible, then, the ride would need to be rescheduled. So how frequent is that? Or is that something that you all track?
That we personally as a company don't really track that. That would probably be a metric that I'm sure the brokerage has some data on. I'm sure Charles could probably speak to that, and Tim. I'm not sure how common it is. That's just worst case scenario. I mean, there's been scenarios where, we're called and asked for an ETA to a ride that doesn't exist on our schedule. And it was because it was added by an automated system and there was no notification of that. There's other things. There's a current system breakdown that's happening within our network that's created more and more of these sort of scenarios where trip information isn't getting communicated, or the system's pulling and re-adding trips kind of on its own, and that's creating an issue. But yeah, I don't have any data on that metric, and I don't think I would argue that it's probably a pretty slim, small number. And I know and/or would hope at least that the brokerage is pretty forceful in their use of corrective action to eliminate that as an issue moving forward. So
great.
I know we have a pretty strong network here. Anyways, my next, I guess, would be managing chronic member no-shows. Progressive interventions, like higher level of verification. If the member is, no-showed 3 times in 30 days, or, you could figure out what the metrics look like. But I think verification is really important, and kind of gets to Steve's point and some points that other people have made. If you can actually contact that person, ahead of picking them up, or even put the responsibility of confirming on them ahead of their ride, like 2 hours before, or something within a reasonable time window that is going to, mostly affirm that they are going to their appointment. That would be something that you could do. Maybe will call scheduling, which I really like the idea of a will call schedule, where it's like, hey, you just call us when you're ready to be picked up within an hour, and we'll get somebody over to you within an hour. It's just like an alternative type of trip that might work better for people who chronically no-show. Pre-trip confirmation, just having, case management referral. So having somebody who's either providing care or supporting that person, follow up to see if there's anything that can be done to eliminate those continuous no-shows. I know that there's some stuff that happens with certain like subscription trips, like the dialysis community and some other folks who regularly attend appointments. If there's chronic no-shows, oftentimes it has to do with like there's an address that's wrong or a phone number that's wrong, or this person's been in the hospital for 3 months, or stuff like that. And those sorts of things can get ironed out just by somebody working to get a hold of them and being able to. Preferred providers. I think this is something that I've argued for a long time, but I think if you can match members with providers that can perform the service and communicate and develop relationship with people, it creates an incredible advantage for I would say any of the brokers, but specifically for people that are receiving NEMT services. If they know and can communicate more directly with a provider who always serves their rides, their notification rate on, hey, I'm actually going to cancel my trip, because they care. There's a relationship there, and they care about you as a company, but they also care about making sure that you show up for them for their rides, and they want that relationship to be, synonymous. Like it wants to be good on both sides, ultimately. So I think that's an idea that I think could really gain some ground in providing some good results. Facility coordination, and then I guess the trip payment idea. This is kind of a touchy subject, I know, for a lot of folks who aren't a transportation provider, but me being a transportation provider, I have strong feelings about this that I feel like are reasonable. I don't think that every no-show is the same. You can pull up and find out immediately that somebody's no-showing. You can be on your way. So it's not as much of a time waste as it is when you've called 3 different phone numbers, contacted the brokerage to see if they have any additional phone numbers, gone to 2 different locations, walked up and down the hospital and spent 25 to 30 minutes trying to find somebody. I mean, we really make every effort to avoid every no-show that we can. We're not really the type of company, unless we're like really under the gun, where it's like, we're just going to give you the 15-minute window. We're going to wait here by the entry that you said you're going to be at. And if you're not there, we're going to leave. Like, we really do make every effort. And so I think in those situations where you just can't make contact and you've tried everything, you've exhausted all of your opportunities, those are those ones that should be eligible for at least consideration for payment, because you're making a big effort to try to keep the no-show from happening. And sometimes there's nothing you can do. Or the, staff says it's going to be another 15 minutes and they keep saying it's going to be another 15 minutes every 15 minutes until it's been 45 minutes. So you have this hope of doing a ride, and then it ends up just being a complete waste of time. You're moving trips, you're doing everything you can to try to get that person home, and still it ends up as a no-show. Those are like the circumstances that are like, come on, man. There's I guess there would be some verification needed, like data verification, whether it's telematics or GPS timestamps. Photo proof was another idea. Having a driver submit a photo of them being at the location at that same time. Dispatch verification. Facility confirmation. That's pretty much all I got.
Okay, great. Thank you. Those are great. Thank you, Joel. Charles.
So yes, Joel, you are correct. We do have that data, and it's certainly something that we can share. I'm sure Tim has very similar data there as well. As far as the pre-assigned provider, we've added that in a key group of subscriptions up in the Ride to Care network, and that because of the consistency with providers and drivers, we've been able to reduce the no-show rate on those trips under 4%, whereas the network as a whole is between 10 and 11%. So it works, and that's something that we've very closely monitored. It does take quite a bit of work, but it can be very effective for those consistent sub trips. So, and I also want to say that each of the things that you brought up are great examples, and I do think that that for providers that do that extra piece about trying to not just willy-nilly no-show trips with basic verification, I think that the broker that is assigning the trip you as the provider have done your part and attempted to do that, gone to the location, you've done your best to be able to pick that up. There are going to be times that the trip just doesn't happen. And I think that it would be completely reasonable to at least pay a base rate for those folks that are able to show that they did that job. And then also speaking about, as the previous provider was talking, there is still an education piece around pickup windows for members. Understand that they don't necessarily want to have to wait an extra 20 minutes or such, but it does need to be made very, very clear. This is a pickup window. Please be ready to go at or before that pickup window. We still regularly hear of folks waiting literally until the last couple of, in some cases, couple of minutes at the very end of the window to even start getting ready, which means that they're not going to get where they need, and the transportation provider has met every piece, and they're not able to complete that trip. So I think that there's a lot of work to be done there also.
Great. Thank you, Charles. So I think at this point we've got 3 minutes left in our meeting. What I would encourage each of our TAC members to do, if you have other ideas about suggestions for these areas, send those to me. That would be fantastic. If you have sort of reactions or, I agrees with the things that you've heard, it's helpful to hear those as well. And then I'll work on putting together sort of a master document for TAC members to review and add to and ultimately approve, hopefully. So our next meeting is scheduled for May 15th. We'll be back in May talking about call center metrics, sort of experience around the call center, et cetera, and informing materials. This is really looking at writer guides, tutorials, live trainings, those sorts of things. And I think, a lot of these things sort of interlace with one another. So as we're talking about the things we're talking about today and last time, these things that we're going to be talking about in May are also important, and vice versa. So looking forward to that. If you need anything in between then, I'll be reaching out to you with the information that I mentioned. But if you need anything, definitely feel free to reach out to me. And I think with that, we're wrapped up. But George has his hand up. So George, did you have some last thoughts or questions or anything?
Yes, some suggestions.
Perfect. Go ahead.
One is maybe see if something can be set up between the brokerage and consumers where there can be texting going on, letting the consumer know that their ride is on its way, that the provider is on the way. Second, I was wondering if it could be something in the contracts or whatever with brokerage or whatever, and getting providers to expand their fleet. That will also stop causing the problem. Because as a consumer, you're having to wait an hour, hour and a half for a ride. And the other suggestion would be for brokerages to kind of maybe get an extra phone number that a consumer can call when they're going to be late to relate it to the provider.
Okay, like a hotline type of thing, George. Is that what you're talking
Yes.
about? So it's like you get right to the right person. Okay, great. Yeah, great suggestions. All right. Well, thanks everyone. I appreciate everyone's attention and contributions. Appreciate another really good meeting. So take care and be talking to you soon.
Thanks, David.
Bye, guys. Bye, Michelle.
Thanks so much.